Assalamu alaikum jameen. Thank you, SCAPE platform, for this invitation to present a short video on critical appraisal for scientific research. So here's my three main objectives for the talk. So I'll set the stage with some overview of why should we care about critical appraisal of published research. And next, I'm going to highlight some of the elements that you can focus on once you start the process of critically appraising published research to really glean from that published research the benefit, if it exists, and to guide your practice. And then I'll finally kind of shed light on some of the tips that hopefully could help you develop experience and develop confidence in critically appraising scientific research and hopefully becoming a stronger scientist and a clinical practitioner if you are. I really like this cartoon because it is so true that we're really exposed to daily news, either through social media or through newspapers and news outlets about some of the examples of things that affect our lives. So things that could either be described as beneficial, that may guide behavior, like, for example, coffee, smoking, exercise, and various things that you could hear that they're either good, they cause benefit, or they cause harm in a specific group of people. And we all remember what happened during the COVID pandemic, where the drug for malaria was broadcasted all over the news, and even by some celebrities that it's a beneficial drug. Well, in fact, once the literature was synthesized, we identified that this was not a beneficial medication or solution. So that's one reason why we should care about critical appraisal. And the other one, if you are a clinical practitioner, if you are guiding decisions related to patient care, sometimes you really need to make decisions that are informed clinical care. Sometimes you may be faced with a decision where you have to make sense of the result, and also things where you are able to understand what the result means to make an informed decision about a treatment option that you're trying to do. So those are really important reasons why we should pause and think that we are able to guide clinical care and practice through scientific evidence. So what is this scientific evidence? It is, in particular, critical appraisal of published research. So it is the process of systematically assessing the validity, the usefulness, the relevance of that evidence in the literature. So it's a systematic process that you as a scientist has to go through to make an informed decision as you go about your practice. It's really important to highlight that in critical appraisal, you're not only looking at abstract, you have to look at the whole evidence and do a comprehensive process where you look at various aspects related to the statistical rigor, related to the methodology, and really try to synthesize the evidence to help you make an informed decision about a medication or even any clinical practice related to that decision. The good news is that critical appraisal, unlike meta-analysis, it's not something that restricted those with extensive experience. So you have to develop some experience in research method, and then you can comfortably conduct critical appraisal as a junior or an experienced researcher. If I had to sum up, what is critical appraisal and how is it helping us? I can think of this statement, and it's all about asking the right questions. So once you develop the experience to ask the right questions, I think you could become more comfortable in being a researcher or a scientist, a clinician that ask the right question in order to guide the result in the right direction, whether it's supporting or rejecting those results. In particular, I can think of 4 reasons why critical appraisal are significantly important. And the first one is, we are faced with growing science. We are faced, especially in the kingdom, with a more educated population that actually may reach the level where they actually ask us questions about research, about new medications from the literature. So we have to be up to date in order for us to keep up with the highly educated population. The second reason is that basically to filter out poor science, you have to acknowledge that not all science is excellent. Not all science should be taken for granted. I really like this quote from this scientist that states, it's usually come out as a surprise to students to learn that some published articles belong to the bin and should not be used to inform practice. And it's absolutely true. You will see that as you develop more experience. So an important role, and in my opinion, this is the most important role critical play is to filter out poor science. The third reason is the science may be accurate, but the science may be correct, but it's not very accurate. So critical appraisal really help you set the tone to the level of evidence, to the strength of the evidence, to the amount of statistical difference. So studies that do not report the methodology and their published literature may actually provide false results. This study suggests that as much as 25% increase in the result that actually in the studies that do not fully report their method section. So it's important for you as a scientist to identify that and then hopefully tease out that issue. Lastly, the fourth reason why critical appraisal is important is for you to tease out any conflict of interest. And unfortunately, this does exist even in developed countries like the United States, Canada. Studies could be funded by the industry, any industry, not necessarily pharmaceutical industry, and they could drive their agenda. And with the emergence of a lot of predatory journals, some of which may be indexed in databases like PubMed, they could drive their agenda. So a study, according to this study, studies that funded by pharmaceutical companies were found to be 4 times as more likely to give results that are favorable to their company than independent studies. So those are the main 4 reasons why critical appraisal is important. So in a nutshell, what are we doing what are we evaluating when we're saying we're doing critical appraisal? In a nutshell, we're doing 2 things. We either evaluate, or both of the things, hopefully. We're evaluating extrinsic factors, things like where the author came from, what is their affiliation, what is the journal that published the paper, who funded the study, is there any conflict of interest, meaning, for example, somebody worked for the tobacco companies and he published a study about the lack of harm of tobacco. So that's a huge conflict of interest. So those are extrinsic factors. What I'm going to be focusing on in the next few minutes is basically intrinsic factors, things that are related to the study design, the study execution. And for that, if I had to sum it up, it would be a set of 3 questions. Under each of them, a subset of questions are asked. For the first 2 questions, the answer has to be, set of questions has to be clear. Some of them are yes or no, and some of them are more elaborate. But my advice is that if the first 2 questions are not answered appropriately, don't even bother reading the paper, and you could just disregard the paper as poor study and not take the evidence or even reference that study. So let's go deeper into each one of those 3 questions. So let's start with the first question, and that is, are the results of the study valid? So under that, you ask a set of questions. So why is this research being studied? So this is usually something that you should see in the abstract, or most importantly, in the background or introduction section. So what is the context of the study? Why did they do it? What is the study about? So once you read the introduction section, you should be clear on the rationale or the main goal of the study. And also, if it's an analytic study design, you should get an idea what is the hypothesis they're trying to test. Good studies include what we call the PICO format, where you actually can easily see what is the population of interest, what is the comparison group, what is the intervention they're doing, or what is the risk factors, and most importantly, what is the outcome they're evaluating. So the third subset question is, what type of study has been conducted? So is this a primary study, meaning the investigator collected the data themselves, they ensured the quality of the data collected, or it's a data set that they used from another study, and that other study is not really strong? So those are some of the questions that you should be asking, and based on which you decide, well, that's a high quality or low quality. The other question is asking about the study design. And from learning about the study objective, you ask yourself, was this the best or most appropriate type of design for this research question, or they could have done a better job? Was the way they collected the data increased the validity? So, for example, they use repeated measures of hypertension, of systolic blood pressure to validate that this person is actually hypertensive or not. So those are some example of the question that you could ask in order for you to make a decision about the rigorousness of the study. The second question, or I would think of it as a mere umbrella of a subset of question, is basically, what are the results? So you're looking at a case control study, you would expect to see some result presented. They have to be presented in what we call a measure of association format. This could be either relative risk, odds ratio, hazard ratio, change in mean difference, sensitivity, specificity, depending on the study design. You have to look for the most appropriate measure of association and really try to understand from it whether that was related to the research question. I've seen measures of associations that are not related to the research question, and that's really important. The other thing is the type of analysis. Was this the most appropriate type of analysis to be conducted or not? You look at the statistical significance, the confidence interval, how big is the estimate, for example, the odds ratio, 1.01, is that meaningful difference or not? Is this confidence interval precise or it's not precise? If you are not familiar with statistical analysis or statistical methods, the wider the confidence interval, the less confident you are about the result. And most importantly, when you're evaluating the statistical part, is thinking about confounding factors. So is the result adjusted for potential confounding? Those are really important to take into account. When you're looking at a cohort study or a clinical trial where a drug was used, you have to look at how many people dropped out or lost to follow-up. Those are the ones who started in the study but ended up not completing it. Was that according to the protocol? Did they address it using sensitivity analysis? Those are a really important question to ask. Do you believe the results? Thinking about selection bias, how the patient or the participant were selected. Does that support causal inference or causal relationship or not? And lastly, asking the question about if this is a positive finding, is this a concern for what we call publication bias, because there was a positive association, the results were published. So you really need to think about these questions once you're evaluating that literature. The last component, and that's a more subjective component rather than the first, relative to the first two, is basically, is this study relevant? Is this research question relevant to the body of the literature? And it's, as I mentioned, it's a relatively subjective assessment, but you have to dig deeper in thinking about your practice. If you're a pharmacist or a physician, could this result be applied to the Saudi populations? Do we have very similar demographic or even age composition? So those are the things that you need to take into account when you're evaluating that literature. Clinical figures, so we talked about statistical significance, but clinical significance is also important. How meaningful is the result? A change in 1%, is that important or not? Those are really important questions. And lastly, a really important question, thinking about medication, for example, are the benefits justifying potential harm? An example of this, so if you have one patient that has bleeding for every 5 patients that are prevented from a major stroke, is this drug going to help our patient, taking into account its potential side effect? It might be that you may take this decision, you may not, but certainly you would reject this medication if 5 patients have a major bleeding for every stroke prevented. The medication or intervention may not be worthwhile. So in both cases, the treatment prevents stroke, but side effects are really different. So in terms of take-home message, so to become a comfortable or an expert in critical appraisal, you need to develop experience. And it is extremely important to support your clinical practice because it is an instrumental step of evidence-based medicine process. If you publish more, if you review more, you will become more comfortable in critically appraising literature. But I highly encourage you to invest more in advanced research method, and that will help you develop more experience. Finally, practice, like any other disciplines, makes perfect. So don't be discouraged if you feel it's a challenging process in the beginning, but as you develop experience, you'll certainly master it. Finally, I would like to thank SCAPE platform for this opportunity, and I really hope you learned a thing or two that will help you in your research career. Thank you.